Hi, everybody. My name is Jackie Bobek. I am a Master of Public Health student at Eastern Washington University. Today, we're delving into the world of Campylobacteriosis, or Campylobacter, a significant bacterial species with implications for public health and food safety. So, what is Campylobacter? It's a type of bacteria commonly found in the intestines of animals, particularly poultry like chickens and turkeys, as well as cattle, pigs, and even household pets. According to the National Center for Biotechnology Information, Campylobacter is a bacterial species known for causing gastrointestinal illness in humans. It's one of the most common foodborne illness worldwide. As stated by the New York State Department of Health, Campylobacteriosis, the illness caused by Campylobacter infection, can occur through consuming undercooked poultry, meat, or unpasteurized dairy products contaminated with that bacteria. So let's dive deeper into the world of Campylobacter and explore its impact on the human health with the measures we can take to mitigate its effect. Some historical context. The identification of Campylobacter as a distinct bacterial species was found in the 1970s. Campylobacter became one of the most common bacterial causes of foodborne illness worldwide. Growing awareness of Campylobacter's impact on public health and the implementation of preventative measures, continued scientific investigation into Campylobacteria, epidemiology, pathogens, and treatment options. Let's move on to the different types of Campylobacter. Campylobacter comprises of several different species, but the most common cause of human illness is Campylobacter jejuni. However, other species such as Campylobacter coli can also cause infections in humans. These bacteria are commonly found in the intestines of animals, particularly poultry, which is a significant source of human infection. Campylobacter jejuni and Campylobacter coli are other species within the genus that may cause infections as well. The main route for transmission for Campylobacter is through the consumption of contaminated food, particularly raw or undercooked poultry products. This includes chicken, turkey, and other poultry meats. Additionally, unpasteurized milk and untreated water can also serve as sources of infection. Aside from foodborne transmission, Campylobacter can also spread through contact with infected animals like household pets, like cats and dogs. Direct contact with feces from infected animals or contaminated surfaces can also lead to infection. Now let's talk about symptoms. Most people who become ill with Campylobacter experience symptoms such as diarrhea, which can often be bloody, abdominal pain or cramping, fevers, and sometimes nausea or vomiting. The onset of symptoms usually occur within 2 to 5 days after exposure to the bacteria and can last for about 1 week. In more severe cases, the symptoms may persist or become more pronounced, leading to dehydration or other complications. Recognizing the symptoms of Campylobacter infection is important for prompt diagnosis and treatment. As you can see here, our at-risk populations cover a wide variety of people, such as pregnant women, infants and young children, older adults, and people with weakened immune systems. Testing for Campylobacter infection should be conducted by qualified healthcare professionals or certified laboratories. Campylobacter infection has several stages of transmission, each with its own infectious window. Here's an overview based on information from the Cleveland Clinic. First, we have exposure. The infectious window begins with exposure to Campylobacter bacteria, which can occur through consumption of that contaminated food or water. The incubation period. Following exposure, there is an incubation period during which the bacteria multiply within the body. Symptom onset. After the incubation period, symptoms of Campylobacter infection usually begin to manifest. Then we have our infectious period. During the symptomatic phase, individuals infected with Campylobacter can shed the bacteria in their stool. There are a variety of preventative measures to Campylobacter, like hand hygiene, food safety practices, personal protective equipment, environmental controls, and education and training. If you have a patient who's suspected of carrying Campylobacter, we could use chemical disinfection, UV, heat, or fumigation treatments on the room. There's definitely different treatment opportunities such as fluid replacement, antibiotics, symptomatic relief, rest and recovery, and follow-up care. And I hope that this presentation helped you understand what Campylobacter is, the transmission and susceptibility, prevention and control, and the treatment and management. Here are my references. If anybody has any questions, feel free to reach out. Thank you.